This guy, let's call him Chuck. And Chuck is about to become one of the most prolific serial killers in U.S. history. So Chuck, he's a nurse, and one day he's at work, working at a hospital, and he looks down at a patient, and the patient is crying in pain. So Chuck looks at him, and Chuck is like, I really want to help this guy by putting him out of his misery. So then Chuck secretly injects the guy with a bunch of lidocaine. And the guy passes away. And I guess afterwards, Chuck feels pretty good about himself because he does it again and again and again. He'll like sneak into their room and he'll secretly spike their IV drips with insulin. And then of course the patients will pass away. And he does this for a while. And over time, the hospital starts to wonder, why are so many patients overdosing on insulin? And Chuck is the nurse in charge of most of those patients. So he immediately becomes a prime suspect. But unfortunately, the hospital can't quite prove that Chuck intentionally unalived anyone, so they allow him to resign. And then a month later, Chuck takes a new job at a different hospital. There, he slips 3 elderly women a heart medication they don't need, called digoxin. The digoxin, of course, kills them. Then about a year later, he's working at another hospital. And there, same thing. He unalives a 91-year-old woman with digoxin. Then he gets a job at a rehab center. And there, one night, he sneaks into a patient's room while they're sleeping. And he's got a syringe, and he's about to unalive them. But luckily, the patient wakes up and fights back. And apparently, there's some kind of struggle, and it ends with the patient having a broken arm. And so yeah, of course, then the rehab center fires Chuck. Oh, but Chuck, he just keeps on going. He, again, gets a new job at a new hospital, and there he unalives another patient with digoxin. Then he leaves that hospital and does the same thing at a new hospital. Then yet again at a different new hospital. He unalived 5 more people. So at this point, Chuck's been secretly unaliving people off and on for about 14 years. And no one has ever really caught him because no one can prove he's the one who's doing it. Until one day, Chuck gets a job at a new medical center. And there, he meets an ICU nurse. Her name's Amy. And Amy likes Chuck. She thinks he's a good nurse who has a lot of knowledge about medicine. So quickly, Chuck and Amy become work friends. They talk all the time at work. He really opens up to her. But secretly, on the side, Chuck is still murdering his patients. Then, one day, an assistant pharmacist working at the hospital pharmacy, they notice a suspiciously high amount of deaths in one ward. And the deaths are all due to overdoses of insulin and digoxin. And police, they start looking into these deaths and they start connecting the dots, and all roads are pointing to Chuck being the one responsible. So the hospital immediately fires him, which sucks for Chuck, but police realize Chuck can just go get a new job at a different hospital, and police want to stop that from happening. They want to charge him with murder, but first, they have to find proof. So they go to Chuck's friend, Amy, and they tell her everything. Everything Chuck's been doing, he's been unaliving patients. They show her all the proof they have, and Amy is shocked. I mean, this is her friend. So police ask her if she'll help them bust Chuck. She'll wear a wire, and she can go meet up with him and see if she can get him to confess. And it's a tough decision, I'm sure, but Amy ultimately agrees. So she wears the wire, and then she hits up Chuck, and she asks him to meet her at a restaurant. So then Chuck comes to the restaurant to meet her, and they're talking. And Amy's clever. Once she gets him talking, she gets him to admit everything he's done. All the unalivings, all the patients, exactly how he did it, everything. And she records the whole thing. So finally, after a 16-year spree, Chuck is finally arrested. Here's his mugshot. And when all is said and done, he admits to unaliving around 45 patients total. Although in retrospect, they actually think it might be closer to 300. But they can't really prove it due to lack of records. Regardless, Chuck goes to trial, he's found guilty, and he's sentenced to 11 different life sentences, like over 400 years in prison. I don't think he's getting out.